How do doctors choose the right cancer biopsy type? Imagine trying to find the best way to get a small piece of a puzzle so you can see what the whole picture looks like. That's what choosing a biopsy is like for doctors. They need to pick the right method to get enough tissue to understand what kind of cancer might be there. The decision depends on where the suspicious area is, how big it is, and what kind of information they need. If the suspicious tissue is close to the skin, doctors might choose a simple skin biopsy, like a punch or shave biopsy. These are quick and usually done in the doctor's office. But if the area is deep inside the body, like in the lung, liver, or lymph nodes, they often use imaging tools like ultrasound, CT scans, or MRI to guide a needle right to the spot. This way, they can reach deep tissues without making a big cut. When more tissue is needed, doctors might opt for a surgical biopsy. This can mean removing the entire lymph node or part of the tumor. Surgical biopsies give the most tissue, which helps in understanding the cancer better. For smaller samples, fine needle aspiration uses a thin needle to pull out a few cells. It's less invasive and causes less discomfort, but sometimes it doesn't give enough information. Core needle biopsies use a thicker needle to take a small cylinder of tissue. This method is often preferred for breast tumors or lymph nodes because it shows more details about the cancer's structure and type. Surgical biopsies are used when a bigger sample is necessary or when the diagnosis is complicated. Doctors also think about the patient's overall health. If surgery might be risky due to other health issues, they choose less invasive options like needle biopsies. Some procedures need local anesthesia, while others might require sedation or even general anesthesia. The purpose of the biopsy also matters. If it's to find out what kind of cancer it is, doctors want enough tissue to analyze. If they are checking if the cancer has spread, they might target lymph nodes or bone marrow. Sometimes, biopsies are done during treatment to see how well it's working or if the cancer has come back. For families and caregivers, understanding how doctors choose the biopsy type can make discussions easier. Knowing that the choice balances getting enough tissue, safety, and comfort can help everyone feel more confident. It's always good to ask what the procedure involves, how long it takes to get results, and how those results will guide treatment. In the end, doctors pick the biopsy method based on where the tumor is, how much tissue they need, the patient's health, and what they hope to learn. This careful choice helps ensure the most accurate diagnosis with the least discomfort and risk for the patient.